Ovarian cancer is the leading cause of gynecological deaths in Canada. Every year, 110 women in Manitoba are diagnosed, and in most cases, it's in late stage and difficult to treat. But a new drug is offering new hope. And joining me now to explain is Dr. Christine Robinson, a gynecologic oncologist at Health Sciences Centre here in Winnipeg. Dr. Robinson, good to speak with you.
Hi, thanks for having me.
First, maybe tell us a bit about this new drug, Elahere, and what it offers Manitobans.
So it's a new drug that can provide some overall survival, which is a big deal when it comes to the cancer world, to a certain population of ovarian cancer patients that have actually stopped responding to the most popular type of chemotherapy that we offer. And so certain patients have a special receptor that this new drug will target to provide survival benefit for them.
This drug was approved under a new program initiative called the Target Zero. Can you tell us a bit about the program and what it aims to do?
Yeah, so once Canada approves a drug saying that it's safe to use in patients, it does take a lot of time before the drug becomes available to patients and covered by provincial drug programs. And so what this Target Zero initiative aims to do is to decrease the amount of time between those two things. So, a lot of times patients have to wait still a long time before they can get access to the drug in Canada, even after it's been approved.
And gaining access to new treatment is a real challenge for cancer patients. What impact could improved and, quicker access have on outcomes?
Well, certainly, these patients in a recurrent setting, which is the patient population we're talking about with this drug, doesn't have a lot of time, right? So we're in a recurrent setting. Any disease, could progress very quickly in that setting, and patients, need access to these drugs in order to improve survival and make their lives better. Not only survival, but also quality of life is important with these patients too.
Talk to me a bit about some of the challenges gynecological cancer patients have right now.
So, getting access to care is always challenging, right? So, in Canada, as you know, we have a public health system. And so sometimes getting timely access to biopsies and CT scans so that diagnosis happens quicker is a challenge. We, as an oncology group, try to get patients in very quickly to see us. But then there are delays sometimes after we see them about getting access to OR time. There's only so many of us and so many resources that we have. And then once we start offering treatment to patients with chemotherapy and new drugs, then getting access to those drugs is not always possible, for various different reasons. And so those are the big challenges we face here in Canada.
So a new drug definitely helping in that fight. Dr. Robinson, thank you so much for your time and insight tonight. It was great speaking with you.
Thank you very much.